start, I'm just going to share some information about the Muslim Women's Network very quickly, and then I'll introduce our speakers. So the Muslim Women's Network is a registered national charity. Ultimately, we work to improve social justice and equality for Muslim women and girls and do research, advocacy, and campaigning. We also have a national helpline. It's called the Muslim Women's Network Helpline. It operates Monday to Friday, 10 a.m. until 4 p.m. and it's faith and culturally sensitive. We've been in operation since 2015, and I just thought I'd share our top issues on the helpline of 2020. Domestic abuse is usually our top issue, and mental health and feelings was our top last year. And I think we'd all agree that it's been a challenging year for many, and so it's it's obvious that that would be our top issue for 2020. Divorce, housing and homelessness, and faith and spirituality also featured in the top 5 issues last year. But the helpline itself is not a single issue, so a caller can call us or email us or text us on anything, and we're able to provide information, advice, support, and referral to other agencies as well. Next slide, Rizwana. The only final thing I'm going to tell you about Muslim Women's Network now is that we recently launched a hub, an online member platform, where our members can share articles, videos, their organizational work, campaigns that they are doing. And so the recording of this video will then sit on MWN TV, which is the YouTube channel for the MWN Hub. So I'd ask you to check it out. It's free. There's no sign up or anything. And if you are doing work in communities, it's a really great platform to share what you're doing. I'm going to stop there and move on to our speakers, our panelists. So we've got Dr. Iram Sattar. Dr. Iram Sattar joined the Muslim Women's Network UK in 2009 as a board member. She's a GP and has a particular interest in addressing inequalities in health, particularly mental health, and has set up, innovative ways of treating patients historically. She is also a board member for a homeless charity called The Passage, and her input with the Muslim Women's Network has helped us really think through so much, but particularly on mental health issues. We also have Dr. Farzana Hussain, who lives and works in Newham in East London. She has been a GP principal at the Project Surgery for 20 years and looks after a list of 5,000 patients. We've seen Farzana a lot in the last few months, I think more so given the amount of work that she's been doing around education and information sharing. And I'm really pleased that you're here, and you were awarded the GP of the Year in 2020. So huge congratulations on that. We're also joined by Dr. Samira Hassan. She's a GP who works in Leicester and is also one of the founding members of the British Somali Medical Association and serves as a vice president. In that role, she worked on developing the foundation of this organization, whose mission is really to include the widening access to medical training, peer support and mentorship, professional development, community engagement, health advocacy, and health education, and does a whole host of webinars online, like all our panelists here today. So I think we're really in good company. I'm now going to pass on to Dr. Iram Sattar, who's really going to talk about the context of COVID and what we're facing right now.
Thank you very much, Faiza. So, like Faiza said, I've been asked to kind of start off by setting the scene, really, of COVID. I mean, we've all lived through this past difficult, straining, and unprecedented year, really, haven't we? I mean, that word unprecedented has been used a lot, but it really has been a 1 in 100 year pandemic, and it's something most of us haven't seen before, and hopefully none of us will ever see it again. So the effects and the stress it's placed on us as individuals, on families and on communities are things like isolation, not being able to see our loved ones, the uncertainty and fear around jobs, finances, getting ill, or even worse, dying from COVID. The stress of schools being closed, both on children and on parents, parents having to be kind of full-time workers and full-time teachers. The death and illness caused by COVID and also long COVID, and not being able to attend funerals, which is so important because grieving together is really, really necessary. And then there's the effects yet to come in the months and years after we get through the pandemic. So that's the economic effect on jobs and livelihoods, but also the mental health effects on both children and adults. I'm going to give you some statistics now. People who know me know that I like numbers. So so far, 2.7 million people have died worldwide. Now that's an underestimate because many countries don't really have a system to count all COVID deaths. In the UK alone, so far, this is updated from today, 126,284 deaths have happened within 28 days of a positive test. But if you look at how many times COVID-19 is on the death certificate, it's actually 148,125 deaths. And in the UK alone, we've had 4.3 million COVID cases. Again, this is an underestimate because at the beginning, we weren't even testing everyone with symptoms because we didn't have the capacity. And, you know, these are big numbers, but they're just not numbers, are they? They're people. And it's hard to get your head around these huge numbers. And I'm just going to tell you a little bit about long COVID. Long COVID is when you still have symptoms 12 weeks after your COVID illness started. Symptoms can be tiredness, breathing problems, joint pain, chest pain, cough, loss of smell or taste, brain fog, which means that it affects your memory or concentration, dizziness, anxiety, and depression. 1 in 10 people who have COVID go on to get long COVID. So if you've got about 4 million people in the UK that we know who've had COVID, that means 400,000 people in the UK are going to have long COVID. And it doesn't only affect those who have a severe form of COVID. It doesn't just affect people who go into hospital with COVID. And it's not linked to how ill you really are at the beginning. And who's more likely to get long COVID? Women, those who are overweight, asthmatics, and those over the age of 50. And even children can get long COVID. We don't know about the stats, so they're not completely clear yet. It's obviously much less than adults, but they can get them. Now I'm going to touch upon the impact of COVID on our Muslim communities. So these are, ethnic communities such as Pakistani, Bangladeshi, Somali, Nigerian, and others. So at the beginning of the pandemic, COVID-19 was described as a great leveler, that anyone could catch it and be affected by it. But as time has gone on, the inequalities in health outcomes have really, really shown. So again, some stats. 34% of all critically ill patients in hospital with COVID were from an ethnic minority group. Now, we only make up 13% of the population. So you'd expect 13% in the hospital to be kind of brown or black, but actually it's 34%, so that's almost 3 times as much. Ethnic minorities are more likely to be key workers, which means they can't work from home, so they get more exposed to COVID, and some key workers can't afford to isolate. Also, the ethnic minorities are likely to have less living space, so live in overcrowded housing, which again makes it harder to socially distance and self-isolate. Infection rates are higher, so infection rates are 4 times higher, for example, in Pakistani communities than white communities. And the death rate, or the risk of death, is also higher in ethnic communities. So women are nearly twice as likely to die from COVID, and men more than twice as likely to die from COVID compared to the white population. So, so what I'm trying to say is that we have more risk of getting it and more risk of dying from it in terms of ethnic communities. And this increases risk. In risk, it's not all down to diseases like diabetes or heart disease. It's not even down to deprivation or being poor. Because even when disease and deprivation is taken into account, studies have shown there's still a higher risk for BAME people. And it's not due to genetics either. So what's it due to? This inequality is likely to be driven by something called structural and institutional racism. So what this means, this is not just the one-to-one direct racism we get in this kind of street kind of thing, but it's the differences in the jobs that we do, so i.e. key worker jobs, and in the housing that we live in. And also it's because ethnic communities don't trust the NHS or government or other bodies because of their bad experiences of discrimination and historic racism. This means that they don't go to the hospital or GP on time, or, for example, they may not trust the vaccine. Even doctors and nurses who are from ethnic communities feel more hesitant than white communities to speak up when they're not given the right PPE. And then a little bit about the impact of COVID on women. Well, women are more likely to do the jobs that were lost due to the pandemic, i.e. working in shops, restaurants, hotels, i.e. jobs that can't be done from home. In terms of childcare, they've had to do most of the childcare and may even have had to give up their own job to do the childcare. And then there's domestic abuse, which we all know went up in the pandemic. Lockdown meant that you were stuck in the house with your abuser. So more men may die from COVID. So we know twice as many more men die, but the effects of COVID carry on for a lot longer for women. So that's really what I had to say about COVID and setting the scene and how it's affected us in this last year. So that's the, I guess, bad news. But the good news, and what we're going to talk about for the rest of the webinar, is the vaccine. So again, a few stats: 458 million people have been vaccinated so far worldwide. 458 million. In the UK, 28.3 million have been given the first dose, and over 2.3 million have had their second dose too. So that's a lot of people who've had the vaccine. So we know a lot about its effects. So in the next part of the webinar, we're going to talk about, going to answer your questions first about the vaccine and show you that the vaccine is safe, it is effective, it is halal, and it's needed now. And not having the vaccine doesn't only impact on the person who doesn't have it, but also the rest of the community too. Because less vaccines means more spread means more variants mean there's a risk that the vaccines we have won't work. So that means more lockdowns while the scientists make another vaccine, and then we have to vaccinate everyone all over again. And finally, it's important to note that the vaccine isn't the whole solution, it's part of the solution. It takes time to work. We need 2 doses. So we still need to wash our hands, wear masks, socially distance, and self-isolate when we had COVID until most people have had the vaccine and when the pandemic is under control worldwide.
Thanks, Iram, for that overview. And I think it really, the facts and figures, is something that really brings the seriousness of this pandemic kind of to light. So I'm going to go to the panel now. Like I've just said in the chat, if anyone has any comments as we go along, any questions, I'm going to be keeping an eye on the chat as we go along. So feel free to pose it, and we'll definitely tackle them. The first question I thought I would pose to Dr. Farzana, and that's coming back to the point around the safety of COVID vaccines. So there's a myth that COVID vaccines are not safe. We've heard people talk about side effects. So my question to you is, how safe are the COVID vaccines?
Thank you so much. Assalamu alaikum, everybody. Thank you for joining us on this evening. So this is a very commonly asked question, and an understandably commonly asked question, because of course the COVID vaccine has been developed and rolled out very quickly compared to lots of other vaccines. So why has this happened, and why would we trust it? It's been rolled out in under a year. But because this has been a pandemic, so COVID has affected the whole world, as Iram just said. A lot of money has been put into this research, and a lot of scientists have been doing this research. And a lot of the way the vaccines, 2 of the vaccines work, the RNA, a lot of that technology was already there. So normally, if we're producing a vaccine, we'll invite a couple of thousand people one year, and then some more the following year, and some more the following year. What's happened with the COVID vaccine is that all of that has been put together. So exactly the same number of people were involved in the trials, but rather than in consecutive years, one after the other, they were all trialed together. And there were some BAME people in those trials. That's about 4%. Now, while that doesn't sound like a high percentage, that's still a number of thousands of people. And as Iram said, if we don't trust the trials, 28 million people in the UK alone have been vaccinated. Of course, recently we might have heard about some of the scares with one of the brands, the AstraZeneca vaccine, and that has understandably caused a lot more fear in people. Is this safe? Now, all of the regulatory agencies. So in the UK, we have the MHRA, the Medicines and Health Regulatory Agency, but even the World Health Organization, and interestingly, the European Medicines Agency, although many European countries chose to briefly ban their vaccine campaign and have now started, but all of their regulatory agencies showed that it was completely safe, and actually your risk of having a clot is much higher if we didn't give you the vaccine. So what we would say naturally your risk of having a clot would be higher than if you had the vaccine. So I can say this is, and I wouldn't say something that I personally didn't believe in, that the vaccine is completely safe. I have had both my doses of vaccine, and I certainly wouldn't put something in my body that I didn't think A was halal or B was safe.
Thanks so much, Farzana, for that. And I don't know whether Iram or Samira want to come in there. And I want you to maybe think about this. We've had a couple of questions privately sent to me. One about that the fact, or I don't know if it's a fact actually, but that potentially no pregnant women were included in the trials, and therefore that suggests that vaccines are unsafe. And the other was that there are people that have died from the vaccine, that they've heard that people have died from the vaccine. So that suggests that they're not safe. Samira, Iram, do you have any response to that?
I can add in with regards to the fertility question.
Yeah.
Assalamu alaikum, everybody. Thank you so much for having me and for having this platform. With regards to the fertility question, which is one I get asked very often, and I think it's the biggest cause of concern for women of childbearing age, really, more than anything else at this moment. And it's why the hesitancy is quite high in that particular group. So I think a lot of this theory had started with a particular theory that was circulating about building immunity. Having the vaccine apparently builds immunity against placental cells, which means that it can affect a pregnancy or it can affect future fertility. There's absolutely no evidence to substantiate that theory, but as you can imagine, it obviously spread like wildfire. Now, the reason we say it's safe is not because pregnant women have actually been included in the trials. They have not been included in the trials, in fact. And it's actually quite common for most clinical trials not to include pregnant women and children for ethical reasons, not because we are particularly worried about effects on women. So it's part of the ethical and clinical protocol not to include them, at least initially. But we do know.
Samira, is that for generally, sorry to interrupt you, but is that generally the ethics around vaccines then, for any vaccine?
Yes. So that's in general for most clinical trials, regardless of whether it's COVID related or other trials, drug related, vaccine related. It's very common not to include pregnant women and children initially, at least. Yeah. We know, however, at this moment in time, there's clinical trials underway looking at how it may or may not affect pregnant women. And I know that they're looking at how it may or may not affect children as well as its efficacy and things like that. But saying that, however, although pregnant women were not included in the trials, and we do know that they're not routinely offered the vaccination, again, not because we think it's risky, a particular risk to them, it's because it's not been particularly tested in them. However, women who are pregnant but happen to be at higher risk, particularly women who are frontline healthcare and social care workers, and women who have pre-existing health conditions, which means that their risk of having a severe illness or complications to their pregnancy from contracted COVID-19 is quite high. These women are actually encouraged to have the vaccine because at the end of the day, as with most things in medicine, it's all about the balance of risk versus the benefits. And we do know that COVID-19 is particularly risky to a lot of people. A lot of young or middle-aged people assume falsely that they are safe from having severe illness. We do know that there was a period of time where even our ITUs had 30, 40, and 50-year-olds in there and a few 20-year-olds. Granted, they are at a much lower rate than the 80 and 70-year-olds, but COVID-19 can badly affect the younger group as well. And in pregnancy, it does increase the risk of complications. So for women who are at particular high risk of being exposed to it or contracting it, have been advised by their own obstetricians and their GPs to have the vaccine. Now, Putting that aside, when it comes to general fertility, as in, am I going to be able to have children in the future, which is a lot of the concerns that young women have, there is no evidence that it will impact your ovaries, your uterus, or any part of your reproductive system. As Farzana mentioned, we do know how the mRNA technology works from before. This is something that they've been developing, not the vaccine, I mean the mRNA technology has been developed for the last 10 years at least. And the idea was to use it for cancer treatment and other treatments in the future. But of course, it's been accelerated to be used in COVID vaccine last year. There is no evidence that it has affected, at least in the previous trials, any sign of pregnancy or fertility. And when you think about it, if we're worried about the production of spike protein, which is what the vaccine makes you do, if the spike protein that the vaccine that you are vaccinated with makes you produce is going to cause infertility, then in the same breath, we can say that COVID-19, the disease itself, will affect fertility. And we do know that's not necessarily the case. Lots of young women or lots of women have had COVID-19, whether it's mild or severe disease, have gone on to get better and gone on to become pregnant as well. And I've spoken to a few of the research scientists from the Oxford AstraZeneca group who've done the clinical trials. And they have also mentioned that a lot of their quite a number of their participants who are young women, part of the clinical trials, have also gone on to have children or have been pregnant in that time over the last year. So again, no causality theoretically exists, and it's not even been shown in the clinical trial participants who are being followed up ever since the trials began.
That's really helpful to hear and really reassuring, actually. And thank you for breaking it down so thoroughly so that we could follow it. So I'm going to ask Iram the question around the ingredients of the vaccine. I'll come to you first, and then maybe Samira and Farzana as well. But there's lots of concerns about the ingredients of the vaccine, that it's not halal, that it's got gelatin in it, and is it halal? Is it suitable for Muslims?
Okay, thanks, Faiza, for the question. So both of the vaccines, the Pfizer-BioNTech one and the Oxford AstraZeneca ones, and actually the Moderna one, so these are the three that have been approved in the UK, they do not contain any components of animal origin. And none of the vaccines contain fetal cells in their ingredients either. With the Pfizer-BioNTech vaccine, it's actually with all of them, they've been declared halal by Islamic scholars. And with the AstraZeneca Oxford vaccine, it does contain a tiny amount of ethanol, which is a form of alcohol, but it's less than what is found in a slice of bread or in a banana. So it's not to the level of which we need to say it's not halal. And again, it's been approved as halal by Islamic scholars. And again, like I said earlier, they don't contain any animal ingredients. I actually, I think through WhatsApp, there's lots of misinformation been spreading. And my own father asked me that, is there a pig's hair in the vaccine? Specific, very specific, but at first I was shocked, and but then I thought, no, this is the kind of thing that people ask. And if they get a video by someone who looks like a scientist and or something, then they start to think that this is it true? And my dad asked me, and then that's what's actually made me kind of do my own kind of videos. But so again, just to reiterate, no animal ingredients. And then this thing about fetal cells, so these are kind of cells from fetuses. They in the past, they were used to grow some of the cells that they used to make the vaccine, because at the time that was the only kind of technology around. But there's no fetal cells in any of those vaccines that I've told you about present at the moment. So I would say the ingredients are halal. There's no animal ingredients. There's no fetal cells. The amount of ethanol it's marginal, less than what's found in food.
Thank you so much, Iram. And Soraya's just asked the question on the chat, which says, some scholars said that the Pfizer vaccine was halal. Are you now saying that the Oxford AstraZeneca is halal, which I think is what you are saying? But her concern has always been that there's protein that is in the vaccine. So Soraya, you're asking that the protein in the vaccine makes it not halal? So clarify that.
So with the Oxford AstraZeneca vaccine, it's a virus that carries the mRNA, the code, to to the in the injection, and then your body takes that mRNA and then makes a spike protein. So it's not even the whole virus, just the spike protein. The spike protein is what's found on the surface of the virus. So once your body sees a spike protein, it amounts to immune response, and that's how vaccines work. So the only protein is the spike protein, which is in the kind of COVID. Is part of coronavirus anyway, and in the AstraZeneca, in the Pfizer and BioNTech and Moderna one, they actually inject their mRNA directly, while with the Oxford AstraZeneca one, I should know how to say it by now. The Oxford AstraZeneca one is actually another virus that carries the mRNA, so there's no extra protein apart from that.
Okay, Samira, do you want to add anything? I've got another super exciting question. So is there anything you want to add?
No, definitely, yes. So with regards to the ingredients of the vaccine, the first thing I would say to everybody is that the whole list is actually available online. Nothing is hidden. And I know some of them have extremely complicated names, but you can Google a lot of them and you'll soon realize that a lot of the ingredients are actually part of regular medications that we take on a day-to-day basis. They're part of the food products that we buy and we eat. Some of them are preservatives, some of them are excipients, some of them are fat and lipid molecules, which basically are just oil droplets that is used to suspend the bits of the vaccine that's supposed to work to hold it together. A lot of it is really to make up the vaccine so that it doesn't disintegrate from the time it was processed in the factories to the time it's actually jabbed into your arm. And the actual only new part of it is the mRNA, which is basically a copy. It's not even the real one. It's a copy of the genetic code that is used to make the spike protein. And in other words, it's just a copy of the instructions that your body cells would use to make the spike protein, to trick your body into thinking that it's actually being attacked by the virus. So the immune system responds accordingly, but can never actually give you coronavirus because there is no virus or even part of the coronavirus in any of the vaccines. So there's no chance the vaccine itself can ever give you coronavirus. The worst it could do is not work, and therefore you contract coronavirus anyway. But the likelihood of that happening is extremely low. We know the vaccines have some of the highest efficacy rates. They are far more effective actually than some of the vaccine that we're used to, like the flu vaccine, in terms of how well your immune system responds to it and builds its defense systems against coronavirus. So the coming back to the ingredients, there's nothing in there that is haram. We mentioned, and Iram didn't mention, the ethanol component. Ethanol is actually, again, a very common part of some of the medications we take, again. And what makes ethanol haram and halal, of course, the scholars will tell you better than me, but it's about the percentage. It's not just the fact that there's ethanol or any form of alcohol in there. And if you think about anything that's brewed, if you think about sometimes the chapatis we make or some of the traditional foods we make that use yeast actually produces alcohol, and it's making these little air pockets and bubbles to when you're having these foods. So there's going to be bits of ethanol and alcohol in regular foodstuffs, like Iram mentioned, like a slice of bread because of the fermentation process, or even from the ripening process of things like fruits like bananas. So ethanol exists in small amounts in a lot of the things we eat on a day-to-day basis. The percentage of it in the Oxford AstraZeneca is extremely minuscule. And all the scholars have come together and agreed. There's a consensus, a unanimous consensus amongst all the scholars that all three of the vaccines that have been approved in the UK are halal, and inshallah that should satisfy all of us.
Thank you so much for clarifying that. Farzana, if it's okay with you, I'm going to move on to our next question and come straight to you, please. The question that I have is, well, it's really the idea that not taking the vaccine only impacts me and impacts no one else. Actually, it's my right to decide whether or not I take the vaccine, and it's not going to impact anyone else. What would you say to that?
Well, I would say that I understand the sentiment, but actually it's not quite correct, because for any vaccine to be protective, so when we think about when we take our young children for their vaccinations, the baby vaccinations or the flu vaccination, we need a certain percentage of us, and that's a lot of us, about 90%. So about 9 out of 10 of us need to be protected with the vaccine so that we develop the immunity and the defense so that we are all protected.
Yeah.
So just myself and Iram taking the vaccine, there's a number of us on this call, on this webinar. Even if we took our vaccine, it wouldn't protect all of us, because the majority of us still would be at risk of and have the disease. So it is a bit of a team sport. Unless we are all protected, none of us are protected. So it is true that if you're younger, your chances of dying of COVID are, mashallah, much less than if you're older, although you can still get this phenomenon called long COVID, these nasty long-term illness that we're seeing. But it's not just about protecting yourself, it's about protecting all of us, and particularly our elderly, but people with long-term conditions as well. So lots of young people who might have diabetes or asthma, all of these people are heart disease are at more risk of getting COVID infection. And of course, we know that Black African people, Caribbean people are 5 times more likely to get very sick with COVID. Bangladeshi people are 5 times more likely. So there are certain ethnic groups that are far more likely to get very sick with the COVID infection, which the vaccination can protect us against. So that's what I would say. I would say definitely, make your mind up with the facts, not the fiction. And there is a lot of fiction around, as Iram was talking about. But unless we are all protected, actually none of us are.
I want to pick up, thank you, Farzana. I want to pick up on that point. There is unfortunately a lot of false and misleading information being circulated everywhere. We're all on social media in some way or form, or on WhatsApp, and we're getting a lot of misleading information. So Iram, I want to come to you. You kind of just popped off my screen. I'm hoping you're still there. There you are. And I guess I want to know, and this is something that we've been asked also, is there any truth in them?
Where do you want me to start? There's so many misleading kind of claims, really. So, I mean, I think feel free to bring up any as well. But so if we start, say, with the 5G one, about 5G being
okay, so let me give you 3 that we've had. So the 5G network, the vaccines are being used to chip and track the population, and actually the vaccine may modify your DNA.
So the 5G theory is about 5G mass being the cause of COVID rather than the actual coronavirus, and that is a baseless myth, really. And a simple way to kind of explain that is COVID-19, the disease, exists in countries that don't even have 5G mass, so it can't be all caused by 5G. So that's the kind of your first kind of question. The second one was about microchipping the population. Again, a very common and popular kind of misleading claim. And again, just think about the logistics of it. For every single vaccine to contain a microchip, that would mean that all the scientists, all the people vaccinating, all the manufacturers, all the regulatory bodies, the WHO, the MRHA, so all these bodies that approve vaccines, the EMA, they would all have to everyone would have to be inclusion to actually have a chip in each vaccine. So it's just, firstly, there is no evidence for that, and secondly, even if there was it's just not feasible logistically to do. What was your third one? Remind me again.
So you've done 5G. Have you done the DNA?
DNA. Okay. So so the DNA one is to do with confusion with mRNA and DNA. So DNA is our genetic code, and mRNA stands for messenger messenger RNA, and that, as Samira said earlier, is just a piece of code. It's a set of instructions that tells your body how to make proteins. So our body produces lots of mRNA, and that's how it makes proteins, and that's how we kind of function, really, how we live. So mRNA is not, it's just a piece of code. It can't go into the DNA and alter it. So again, from a scientific kind of basis, there's no kind of really evidence for that theory that mRNA vaccines can't alter your DNA, because they're two different things.
Thank you. And I guess with the mRNA, you said that this is not a new technology, right? So this method has been used in other vaccines, and we just haven't been alive, or to the fact that it has been, and it's only kind of come to popular knowledge, I guess, more recently.
Yeah, so it's a new technology. The woman who designed it, she's Hungarian, I think. Helena Carico, I might have got that name wrong a little bit. Carico, I remember Carico. So she has been working on mRNA for about 40 years, and people are saying that she will eventually get a Nobel Peace Prize for this kind of work that she's done, because that mRNA technology, like Samira said, it was actually developed for kind of for cancer patients and other illnesses as well. So there are a few mRNA vaccines, but the COVID vaccine is the kind of first one to be used on such a scale. There's been trials of the other vaccines, mRNA vaccines.
Okay, great. So I think we'll take one more question, and I'll just scan the chat just to make sure I didn't miss anything. That's fine. Okay,
there was a question actually, Faiza, about long-term effects.
Yes. So yeah, you can take that straight up, actually, Iram. Yeah, go on.
So this is again a common question. How do we know that this vaccine won't have long-term side effects? We only know short-term, but people are forgetting that vaccines aren't new. They've been around for 100 years, hundreds of years actually, and the immune system, how it works. So the science or immunology isn't new. So we know a lot about how vaccines work and how immune system works, and there is no kind of biological basis for where you're going to get long-term effects. So, and the other thing to remember is, I'm not saying that it's zero risk. Nothing in life is zero risk. Taking paracetamol is risky. Taking aspirin and ibuprofen that we take has a risk to it. But the risk, what's important to remember, that the risk of the vaccine is far, far, far less than the risk of getting COVID and dying from it or having long COVID. So this is what people need to remember. You're not comparing it to nothing, and because vaccines have been around for a long time, we know what their kind of effects usually are. None of those have shown yet, and I myself, like Farzana, have had both my vaccine doses too. And again, I wouldn't do something to myself or advise it to my family if I didn't think it was safe.
I think that's a really important point to make, that it's not just, you're not just saying this, you all have had the vaccine, and you're encouraging, your family members, those who you love the most, to have it as well. Okay, so my question for Samira, we've got Ramadan coming up in just a couple of weeks. And of course, we will be fasting, and there are a lot of questions out there right now about whether you can take the vaccine while you're fasting, and also questions around the lateral flow tests and the PCR tests, because obviously in secondary schools right now, I know there'll be some overlap with Easter holiday, but students are having to test regularly, and even other key workers as well. So can you help us out on the Ramadan questions, please?
Oh, definitely. I'd be happy to answer that question. And this is a question that I've been on several webinars where we've had the local imams or the sheikhs join us, and they've rated and added to that. So as from my understanding, and obviously our understanding in general as Muslims about Ramadan is pretty strong, we know that the kind of things that invalidate fasts are certain set criteria. So they're not just vague things. And one of those, or two of those things, are anything that would cause a lot of blood loss, and anything that would add in any form of nutrition or energy or glucose to the body. So you cannot have anything that you swallow directly through your mouth. You cannot have anything either through the mouth, the nose, or through the veins, or any other format that would add in any form of nutrition or energy. And you cannot have any procedure that would cause significant amount of blood loss. So we know the vaccines do not enter any of those criteria. The vaccines do not contain anything that would add in any form of energy or nutrition to the body. We know it's a quick, simple intramuscular injection. It is not even going through the veins. And we know that it doesn't cause blood loss. So it's very easy and very safe to say that it will not invalidate your fast. However, of course, there are common side effects from the vaccines, which include mild headaches, fevers, body aches, fatigue, a sore and a bruised arm, which some people may feel is particularly troublesome when they are fasting.
Yeah.
These side effects are very common and they are a sign that your immune system is working. So it's a positive sign. It's not fun to feel, but it's a positive sign. And oftentimes they settle with paracetamol, which we know you cannot have until you break your fast. So bear that in mind. But again, these symptoms are usually mild and they last between 24 to 48 hours if you get them at all. Yeah. People like my parents have had absolutely no symptoms whatsoever. Myself and my siblings have had fever, temperature, and body aches for 24 hours. So everybody's different.
And also, those are the kinds of side effects that you would get with most vaccines anyway, right? COVID
exactly.
or otherwise.
Exactly. Anything that triggers your immune response into action will cause that. Fever is a sign that our immune system is working. It's not a sign of disease, and obviously the aches and pains are localized because you have had a needle in that area of your body. But again, they will settle down as with most things. And hopefully they're mild enough not to cause you any particular trouble when you're fasting. But again, it does not invalidate your fast. And you can certainly have paracetamol, ibuprofen once you break your fast. Of course, you're not allowed to break your fast for it unless you feel too unwell that you cannot carry on fasting. And of course, that's an Islamic choice that I don't want to make for anybody.
Yeah.
So no,
I think it's helpful also. Sorry, Samira. I think what we'll do also is the British Islamic Medical Association, alhamdulillah, they have such a great resource on their website. I mean, not just one resource, many resources in multiple languages. And I know that they've just uploaded their Ramadan kind of myth-busting section. So Rizwana, definitely share the link on the chat so that everyone can go directly to that. And I think, what we'll try and do is also send it to you afterwards in an email so you can have those links. So Farzana, I'm going to come to you just for the final questions for this part, at least. So I'm just looking at the chat because Rushnara was saying, that people say you will still get COVID even taking the vaccine. And, if you can respond to that, but also maybe Nazia is asking that many people from BAME communities are concerned about the treatment BAME people receive in hospitals. So I think, those are two separate questions. Why don't we deal with the first one first, and then if there's time, we can deal with the second one.
Okay, thank you again. So as Samira was saying, the usefulness of the COVID vaccine against protecting from the disease is quite high. So we've got studies that are showing it's up to 80-90% high. If I put that in context for you, the yearly flu jab that people have, that's about 50% effective. So you've got a 1 in 2 chance of being protected. There is no vaccine that is 100% effective. So yes, you could still get COVID, but your chances of getting it are much lower. So you've probably got a 1 in 5 chance of getting the COVID infection, as opposed to having 100% chance if you're not vaccinated. And also, very importantly, some of the very new research, because obviously we've only been giving the COVID vaccine since the 8th of December, but it's showing that very importantly, even if people are getting the disease, it seems to be much milder. So they've looked at the over 80-year-olds, so those of us who are most at risk of dying of COVID, they have been surviving at a much better rate. 8 out of 10 of them have been surviving the COVID, even if they have contracted it, got it after the vaccine. So it's a double benefit. One is that your chances of getting the infection after your vaccine are much lower. than if you didn't have it. Not 0%, as Iram said. There's nothing that's 100% guaranteed, I'm afraid, in life. But secondly, even if you get the infection, it seems that if you've had the vaccine, your infection is not that severe, and inshallah you're not going to die from it, because that is what we are talking about. It isn't having a vaccine versus nothing. It's having a vaccine versus having COVID infection, which has killed, as Iram told us the statistics, literally millions of people in the world.
And the fact that it can still be transmitted, even now. MWNUK today co-signed a letter with other religious leaders from across faith backgrounds. There's a lot of trauma from the past year, and that's why we feel taking a minute to reflect today is important for all of us.